You guys need a mic check? Are ready for one? Okay. 1, 2, 1, 2, 3, 4. Getting levels? Okay. All right. Yeah. Ready? 1, 2, 1, 2, 3, 4. Okay. Yeah. So I'll remind everyone else, I guess, whoever travels up here a little later, we will be doing the same as last time for those who weren't here. We are now having reporters raise your hand. When Q&A starts, together we'll call it. Make sure you have questions ready. I didn't see enough hands last time. And they'll be on topic only.
Will there be a chance for off-topic after, or
Discussion just did last week.
Yeah.
I can do it.
Okay. I think we'll go ahead and get started. Good morning, everyone. It's day 30 of the federal government shutdown, and 41 million more Americans are about to feel its impact in a very personal way. As federally funded food assistance for vulnerable low-income households is set to end tomorrow, the USDA's Supplemental Nutrition Assistance Program, or SNAP, is 100% federally funded at the cost of nearly $100 billion a year. And as we start the month of November, the first month of the new federal fiscal year for SNAP, there's no budget for that program to continue. As Secretary Rollins has said, the well is dry. And this means that 131,000 SNAP-eligible households in Iowa will have less food on the table. Dems in the United States Senate don't seem to care that everyday Americans are suffering while they force the shutdown into another month. Holding out for $1.5 trillion in a spending bill to prop up the fundamentally flawed Unaffordable Care Act. And we do care here in Iowa, and I know that Iowans do too. And that's why yesterday I announced the state will provide interim support for Iowa's food banks and pantries if the SNAP benefits end as expected. I want to thank my team from the Iowa Department of Health and Human Services, including Director Johnson and Community Access Director Aaron Drennan. And I also want to thank Major General Osborne, Adjutant General for the Iowa National Guard, for their help in supporting this plan. You know, as the SNAP deadline has been drawing closer, Aaron has convened regular meetings with Iowa's 6 regional food banks and other food system partners to understand what they'll need to manage an increase in demand. In response, the Health and Human Services has stood up Volunteer Iowa. They're working to recruit and deploy volunteers to help staff pantries and assist with operations. The Guard will be available as needed to conduct food distribution missions as it did during the pandemic. And I have directed HHS to use up to $1 million in existing state funds to match all cash donations to our 6 regional food banks beginning tomorrow. This is an opportunity for all of us together as Iowans to care for our neighbors in need. And as you can see on the map behind me, there are 6 food banks in Iowa that together support 1,500 local food pantries and other partner agencies across all 99 counties. By making a cash donation to the food bank that serves your area, you can help a family near you keep food on the table. Better yet, your donation will go twice as far because the state will match it dollar for dollar. So a $25 donation becomes $50. A $50 donation becomes $100. And if just 50,000 Iowans each donate $20, we can fully leverage the state's $1 million match to provide $2 million of support to our food banks, and that will make a real difference for Iowans in need. As I stated, that match will start tomorrow, November 1st, and you can go to my website at governor.iowa.gov for a list of Iowa food banks by location and links to their websites where you can go and donate online. I also want to take this opportunity to thank some very generous corporate citizens who have stepped up to support food security for Iowans during the shutdown. Iowa's 3 Medicaid managed care organizations, Iowa Total Care, Molina Healthcare of Iowa, and WellPoint Iowa, have each committed $100,000 for Iowa food banks. Hy-Vee has also donated $100,000, and Fairway and Iowa pork producers teamed up to donate $20,000 worth of ground pork to food banks across the state. And I know there have been several others that have stepped up in the last day to also make very generous donations. I've had churches reach out to me, and they're doing fundraising. So really, Iowans do what they always do, and they are stepping up and helping people in need. So as we wrap up, I'm asking for the media's help and yours to help us inform Iowans who use SNAP about their benefits during this time. So if the federal government remains shut down tomorrow, SNAP users, as you know, will not receive their November benefits on their SNAP card until the government reopens. However, if there is a remaining balance on their SNAP card, the card will work and the balance can be used during November. If the government reopens during the month of November, SNAP users will receive their full November benefit at that time. So, as you know, as the government plays an important role in supporting its citizens, but we shouldn't rely on government alone to do a job that we're all called to do. And we each have a personal responsibility to the people in our communities, especially those in need. But I also wholeheartedly support the President and our congressional delegation's effort to get federal spending in check, to right-size federal government, and to reduce a $38 trillion national debt. But we can't make any headway until we get the government back open. So again, you're going to hear this constant message from me. We need Senate Democrats to vote to reopen the government and get Congress back to work, working on a budget that makes sense for the American people and policies that will help strengthen our country. So it's time to get back to work. It's time to get the government open and end the unnecessary impact that it's having on people that really rely on some of these programs. So with that, I'll go ahead and open up for questions.
It might be a little early to ask this, but can you explain a little bit more of the logistics, particularly with the guard, and where do you see them stepping in for the distribution? Is it largely like outside of the major food banks?
Yeah, I think if we see, it's people. It always comes down to people. And so during COVID, I think you helped with some of the logistics in getting the food to the various food banks. But I'll let you, if you have anything to add to that. And it's as needed.
Yeah, certainly we're taking direction from HHS, but we're templating kind of our support of what we did during COVID, which was movement of food across the state from distribution centers to the food banks and then temporary or possibly to satellite locations, as well as warehouse management or helping them manage the food banks themselves, movement of food, pallets, those type things. And during COVID, as you remember, we packed boxes. We distributed a lot of pre-boxed food. So we're kind of templating our support on that. But right now we're kind of waiting on the demand through HHS on what exactly they're going to need.
Can you put back up the map of the food banks? It's a big area that some of them cover. So there will be probably some need. And then with Volunteer Iowa, we've got volunteers across the state that Larry's team and Aaron will tap into and see where they can help just with manning the pantries, but also possibly with logistics as well.
With the soldiers, does that mean you have to call some in, or do you have enough there that you have to make a run that are staffed that, where they can run the trucks?
We would bring in, first thing we would do is ask for volunteers, and our soldiers and airmen have volunteered to support their communities, state and nation. We hardly ever have any issue with volunteers to come in, especially with these types of missions. So we're looking at these central locations of where the food banks are primarily right now, with the skill sets we need, with the anticipated mission sets. But yes, we will bring soldiers and airmen onto state active duty.
Would they be unpaid for that?
We'll be able to stand up a mission and they would be paid.
They would be paid.
They would be
State
paid
active duty would be paid.
because it would be state active, just like they were in COVID.
As I understand it, you're matching up to $1 million in donations.
Uh-huh.
If those donations don't reach $1 million, would you still plan on donating $1 million to food banks?
Yeah, I mean, we'll donate it where the need is. So if there's a need, we have up to $1 million to match the generosity of Iowans and corporate partners across this state. So it's my anticipation from what I know from Iowans, we'll be able to expend that.
Can you explain how your decision to take this approach versus using emergency state funding to replace those benefits as some Democrats call for it?
Well, it's ridiculous. First of all, we could have ended it 4 weeks ago. We could have ended it if the Democrats would have voted to keep the government open, and they did not. 53 Republicans have voted 13 times to keep the government open. I need 5 Democrats in the United States Senate to step in there and open up the government and not use this as a negotiating tactic, which they have admitted that they are using this shutdown as a negotiation tactic to spend extra money, $1.5 trillion on a system that's not sustainable. And I said that, I'm talking about the Unaffordable Care Act, that I said in 2017 was a system that was not sustainable and not affordable. And if it is an Affordable Care Act, then why do we have to subsidize it with tax credits? So it is a federal program. It cost $45 million a month to support that. And we don't have those kind of funds. And so we need to get the government open. We need to continue the budget as is, and then come to the table and negotiate what they want to talk about moving forward. During the Biden administration, 13 times the Republicans voted for a clean CR to continue the negotiations. That is how it's always been done. There is absolutely no reason that they're not doing that now and putting Americans and Iowans at risk and causing this unnecessary chaos and uncertainty in their life. So they have an opportunity to change it today. They had an opportunity to change it 13 times. 13 times they had voted in the Senate Democrats, to not pass a clean CR. It's that simple. It is that simple to get that done, to put everybody at ease, to move forward, and then get to the table and negotiate the priorities that they're talking about.
And some states are suing the federal government for using contingency funds, the USDA. Can you explain your thinking on that lawsuit, whether you think it would be possible for the federal government to tap those funds?
I think it's ridiculous. I think it's ridiculous, and I think it's a waste of time. I'm going to say it again, pretty darn simple. 5 United States Senator Democrats need to vote with 53 Republicans and open the government. That's what they need to do. And it's a month. The cost of the federal government, I think, is $9 billion. I think the contingency fund is $6 billion. It doesn't even cover a month. I also think that they need to, just like we've done here in the state of Iowa, it's obvious that it's 42 million Americans, it's close, are using SNAP benefits, and that's just about 1 in 8. And so I think, this is a big program. I think we need to take a look at it. We need a comprehensive review of the entire program. Are there things that we can be doing, like we're doing here in Iowa, to help lift people up, to help them get a job and a career where they can take care of their families? This is an important program for individuals that need it, and it's like every other one. There is so much fraud and abuse in these programs that it runs the risk of not having the funds there to help those that really need it. And so just like we have done with all of our programs, and will continue to do with our programs, you need to do a review of it. You need to look at the transparency. You need to look at who qualifies. What are the metrics? What are we measuring? What are the things that we can be doing to get them off? And help lift them up. And so my hope is that, first of all, the Senate Democrats will stop keeping the government closed and open it back up and really start having those kind of conversations about what we do moving forward.
Take time for one more. This keeps dragging on like this. You have to start looking at ways to try to slide state funding in to pay the government, put you on the spot. I understand that, Kim, but as some states are at least having that conversation to at least pay the guard folks rather than make them fill it out their own.
Yeah, especially those that are deployed. We're continually having those kind of discussions. I mean, Erin is having, you have 2 calls a week, I think, right, with our food banks, and have been since at least last week. And before that, I think you were connecting with several of them, just checking in and seeing what they need and what are their concerns and where can we help. And I get an update every week on the government shutdown and which agencies are being impacted, how many are furloughed, how many potentially will be furloughed, what does that look like, are they completely 100% federally funded? So I get an overview of that every single week, and then we're looking at what contingency plans look like. But we can't just shift it to the states. States don't have the funds to be able to do that. And so really, most of these are federal programs, and they need to get the government open like they have in the past and get to work on finding solutions. And that means both parties sitting down at the table and having a discussion. And I think, Leader Thune has said, I'm willing to have that conversation. We'll take a vote on the Affordable Care Act, Unaffordable Care Act, whatever you want to call it. I think he's indicated he would be willing to do that. But you can't hold a gun to somebody's head or have this be part of the negotiations. That's just, it's not effective. And it's not been done that way before. So I think we should, I think it was just like, what was it, 6 months ago, Democrats voted for a clean CR, just 6 months ago. So come on, let's get to the table, let's get this passed, and let's start doing the work of the people and find some solutions moving forward. Thanks.